Hello, this is Jim. This stuff is everything you're going to need to perform an injection. Let's start with the pen. You're going to take that aluminum shield off, and then you're going to unscrew the plastic shield that protects the rod. This rod, when you're done with the cartridge, is going to be up in this position. Okay? That is not the position you want to use when you're putting a new cartridge on. You got to turn this maroon colored wheel, yes, we get it, Jim, and lower the rod all the way back down to its starting position, which is going to look like that. Now let's take your cartridge. First of all, let's notice that there are some dose markings on the cartridge itself. There's the powder and liquid chambers that you are already accustomed to. We're going to take a needle and we're going to put it onto the end of the cartridge. We're then going to use the cartridge activation device, which is this little brass knuckles looking thing with a wheel on it that has an arrow on the wheel. Okay, all it does is that. It makes a rod go up and down. That's it. So screw your cartridge onto the cartridge activation device, and then with your needle pointed up so that air can escape out of the needle instead of liquid, you're going to begin to gradually turn that wheel in the direction of the arrow. Okay, you'll feel some resistance, but then you'll turn until it feels like it strips. Okay, like that. That means it's not going to go any further, but what's happened is you've pushed the two gray plungers together and forced the liquid portion into the powder portion. Now you're going to blend the medicine. I think that going from needle pointed up to needle pointed down, up to down, up, down, is a good way to mix the drug. Tap your cartridge to make sure that all of your air bubbles are releasing from the glass. And remember that if the cartridge looks milky and you can't see through it, if you try to look behind it and you can't see anything, it's too milky. And there's also going to be that large air space that you saw there at the top. That is expected. Okay? But it is no longer friendly once your cartridge is mixed together. The airspace helps you blend the medicine, but then you're going to want to get rid of it. Yeah, there's that airspace there. Tap it, make sure that everything coalesces into that space. What you're going to be left with eventually is an air bubble. And air bubbles are fine, but air spaces are bad. That's too much. The air space, of course, being a space where there's no liquid, just air. I can't believe he threw that thing. It's a valuable piece of equipment. Don't throw it. But you put the rod back down to its starting place, and then you don't need it again until you start a new cartridge. Alright, so remember, keep your rod back down in its starting position. Take your cartridge and screw it onto the pen. Easy breezy. Ta-da! Okay, take your plastic shield off the needle and the other plastic shield off the needle, and that's it. That's the whole injection device. Tap your pen to get the air to go up to the top. We're about to prime, by the way. Tap all of your air up to the top, and with your needle continued to point up, you're going to now focus on setting a dose to prime. Pen starts at 0, you're going to turn it to go. That's all that the pen does, by the way. It goes from 0 to go. That's it. Needle pointed up, push your injection button in firmly. You'll hear a clicking sound, and you'll see in your window that the indicator returns to 0. Hold that pressure. You may see some drops of liquid come out. That's okay. Tap and inspect your cartridge and make sure that you don't still have that airspace. You are probably still going to have some air bubbles, but you don't want an air space. Okay? Reset your pen to go, and now we're going to investigate where you're actually going to do the injection on yourself. Now remember, you're going to rotate thighs from side to side, and there are a couple of don'ts. You don't want to do your injection too close to your knee, and you don't want to do your injection on the inside of your thigh. What you are going to do is focus on the top and on the side of your thigh, the outside, all the way up towards your hip joint. Okay? Make a claw with your hand, nice and wide as you can. Don't worry, it's proportional to your leg. And you're going to squeeze gently, to make a little mound of fat that's being pulled away from the muscle. Clean that site with alcohol and fan it dry. Okay? Take your pen, which is set on go, and your objective is going to be to plunge your needle directly into your thigh vertically, not horizontally. That's bad because you can get air into your needle if you're doing this sideways. So go straight down into the thigh, bury the needle, but you don't have to push any further than that. Hold your button for 8 to 10 seconds, then release it and pull it straight out of your thigh. As you can see in the demonstration here, there's not a lot of liquid in an injection, but that's about the size of it. Now you've got to get your pen back into the refrigerator and go about your day. So again, let's notice that the cartridge window is back on 0 because after you've pushed that button, it goes from go to 0. Take your needle, the big cap, and take the needle off. You lower the cap over the needle, unscrew it, and when the needle comes off, you take it and you toss it into a sharps container. Very important, the sharps container. Then you're going to take your aluminum shield, put it back over your pen. The pen goes into the black case. The black case goes into the refrigerator, and you are done for the day. Congratulations. Consult your printed instructions, and if necessary, consult me. I'm always here to help. And good luck.